Well, you may have seen him in the news. A lot of people would say that he is known as the best-kept medical secret in Jacksonville. So please welcome Dr. Gulani to the show today. Thank you so much, Dr. Gulani, for being here.
Pleasure.
You have Nick over there talking about cataracts. He's like, what's the deal with all this stuff? Why is it getting a cataract can be a good thing? We're going to talk about that in a second. But first, for those of us who might not know what a cataract is, kind of break it down into layman's terms.
Sure. If you look at our eye as a camera, we are born with a lens that's crystal clear. And this is where it is, just like a camera. With age and time, this clear lens now becomes cloudy. So this cloudy lens is now called a cataract. So this cataract needs to be removed. And because it was a lens, we need to put in an artificial lens that stays forever in the eye.
So cataracts, is that just a fact of life? That's going to happen to everybody? I mean, it's not one of those things, well, I hope I don't get them.
Sure.
Everyone gets them pretty much?
So it's not a disease. It's a time-related or age-related change in most cases. And everybody who lives long enough will have a cataract, and everybody who lives long enough will need cataract surgery.
And what I thought was interesting, and I asked you before we started the show, do people, because we were teasing Nick a second ago about, hey, how do I get a cataract? He was asking, well, you know, look at the sun, look up at, you know, and I'm sure the exposure to the sunlight helps to create those cataracts.
Adds to.
Adds to.
Yes.
Okay. Do we find that there are more cataracts in sunnier places?
Yes, and also the other topic of importance which we'll discuss today is because of increased awareness. People are more aware now of their decreased vision as they age. So they're not waiting till they're 70 or really cataracts are ripe or they've gone blind. People are more aware of their vision, so they come in much more earlier.
So what happens during cataract surgery? What are you doing specifically to the eye?
Today's cataract surgery is pretty much an outpatient procedure, 7 to 10 minutes max. It's done with numbing drops, and of course you're mildly sedated. It's a technique we call no stitch, no patch, no shot, meaning no injections, no stitches. With a high-speed ultrasound and using diamond edge micro instruments, you remove the cataract and then you put in an artificial lens, and that stays in its place for the rest of your life.
Okay, and then what is the recovery time for something like this? You say the surgery only lasts about 7 to 10 minutes, which I find pretty incredible.
Yes, the recovery time about a day to 2 days, and then you do the other eye in a week or 2 weeks.
Okay, and then what are the words that you say that you do not like? And when you teach surgeons from all over the world and the country pretty much, you do not like the word routine when it comes to any surgery really, but specifically cataracts.
Yes. To me, cataract surgery, millions are done every year, so it is nearly called a routine surgery. To me, it's an opportunity. It's an opportunity for a patient to start seeing the best they can for the rest of their life. So it's very important that the patient who's been diagnosed with a cataract literally with a smile sits up with the doctor and goes, I know there are technologies today that can actually make me see without glasses for the rest of my life. What are my options?
Yeah, well, so that's the thing. So when we were talking about how having a cataract can be an opportunity, because you go in thinking that you're just going to have the cataract replaced, you're going to have that removed, but you can actually walk out with improved vision and not having to wear glasses as a result of this.
With today's technology, yes, like we said, Casey, to go back a little, cataract is nothing more than our own natural lens becoming cloudy with age and time, so it's not a disease. Since we have to put in an artificial lens, with technology today we can use lenses that can also correct, while we are doing the cataract surgery, it can correct people's glasses numbers like near or farsightedness or astigmatism. It can make people see distance and near. These are called progressive or multifocal or accommodative lenses. Literally, we can put back a patient's refractive error, which is their glasses prescriptions, into the lens. And in most cases, patients can see distance and near without glasses for the rest of your life.
Which is incredible, because you think of the cataract as, okay, I'm going to get my surgery, I might not be able to see as well, I'm going to have to get the glasses, I'm going to have to get... But you're saying that you don't...
Into the lens. And going back to Casey, our previous meeting too, I like to look at vision surgery as an art. You don't select surgery first, you decide what's best for the patient. So if somebody, and millions of people have had LASIK, and they are today presenting at an age where they have cataracts. So it's a time where we again take them to a situation of without glasses through cataract surgery. Now patients who may have had cataract surgery and ended up with glasses can also have LASIK and again see without glasses. So the combination is a true reality today.
So at what point in time, okay, if someone is thinking, first of all, how do you know if you have a cataract? If someone's watching right now, how do you know that you're first starting to see the signs that I might need to do something about this?
So the first things are what is quality of vision goes down, meaning your night vision decreases. You see glare from oncoming cars. Many people don't realize because cataract is a slow-growing process, so they are accustomed to dim vision. But it's very important for the doctors to be vigilant. And with technology that we have today that we brought into the country, you can actually look at the cataract with what we call densitometry, like an X-ray. So you don't have to imagine, you can see it becoming cloudy. And a patient today must be very vigilant that, okay, I'm at the age of my late 50s, early 60s. I may have a cataract. Let me see my eye doctor and let me sit down and find out how to customize my vision through this surgery.
So, you know, and I have heard people before say, you know, the cataracts, it's not that bad. I'm just going to let it take its course a little bit more because, you know what, I don't want to have the surgery. But is it true to say that you could actually, if you kind of do it a little bit earlier than later, you can improve your vision earlier than waiting and having the surgery later? I mean, you have to wait for the cataract to reach a certain point, I guess is what I'm saying?
No. Again, with every surgery, of course, safety being important, that you're not going too early, but you can look forward to cataract surgery once it's diagnosed and start planning for vision for the rest of your life. That's the whole important or the exciting thing of today's times, where even new technologies that lasers have been approved in the US today, where cataracts can be done with lasers, raising the bar again in precision.
So let's show some of the patients, because you have people coming from all over the world to come have this done. What is it like for you being a doctor and being able to then have people walk out of your office or you know, after they have some recovery time to be able to see better than they ever have before?
I think, Casey, it's a privilege to be an eye surgeon, and patients trust and the way they fly to me, and the least I can do is design their vision for the rest of their life.
Yeah, and I know you've had some incredible stories. I know when you were on last time, I think we spoke about that gentleman, that this is really life-changing for these people, you know, thinking that, you know, you don't really realize just how valuable your sight is until you lose it. You know, it's like one of your senses. You don't realize just how much you use it until it's not there.
Yes.
So, well, thank you so much, Dr. Gulani. We appreciate your time. We appreciate you being here as always and stopping by First Coast Living.